Hi, in this video we'd like to continue on our discussion on Hyperemesis Gravidarum. Now this disease is a rare and life-threatening pregnancy disorder that affects less than 2% of women, and there's very little awareness on this disease. Many doctors are not taking them seriously. Women are suffering without proper treatment available, but here at Antai Hospital we do offer you effective treatment that actually works. You don't need to be under a plethora of different drugs and medicines and IV drips anymore. Our HG vaccine, which is our proprietary medication, is easy to administer, and the results can be observed within days of receiving treatment. Now in this video we'd like to talk about how Hyperemesis gravidarum can affect your immune system to the point where a simple cold, simple fever or cough can literally debilitate you and cause you to collapse, and you need to receive immediate intensive medical care to survive. And at the same time you're carrying a pregnancy, it makes matters that much more worse. So as we all know, here at the hospital we are very familiar with HG because it is one of our specializations, and we have hundreds of HG patients coming from all over the world per month receiving our treatment. And we've been dealing with HG patients over the last 2 decades. And even HG survivors watching this video right now, they are very familiar on how depleting this condition is. HG is a condition that depletes you of your life source, your life energy, your will to live, because it can cause severe dehydration, malnutrition, and the constant intense vomiting that you're experiencing. And how does this affect the immune system is that because your body is currently in a state of constant stress and starvation. Keyword here is starvation. Now, how do women actually put themselves in this kind of state? People who do not understand how HG works, especially doctors as well, they feel like these women are actually intentionally doing this. When women complain to their doctors about their hyperemesis symptoms, doctors will just tell them, if you're vomiting, that's fine. Just make sure that you're supposed to eat. Don't forget to eat. But they don't understand that these women are unable to eat. What happens then? They cannot eat and they cannot drink. And this causes them to go into an involuntary starvation mode. And then this can lead to other complications. For example, ketoacidosis, where the body is actually breaking down fats. The mother is losing a lot of weight. This leads to increased ketones in the blood. Blood is more acidic, and this will actually cause more vomiting. And as more vomiting, there will be more starvation. More starvation, there will be more ketone. It's a vicious cycle. That is why in hyperemesis, these women actually, the vomiting gets worse over time. Gets worse over the second trimester, third trimester. That's how severe it is. And when they are in their state of starvation, when there's no vitamins, no nutrients being absorbed by the body, the white blood cells will actually start collapsing. White blood cell counts get to so low, incredibly low, that your immune system is basically collapsed. Immune system has no way of defending itself. So even the most basic sickness that your body usually can handle easily, now it can actually severely debilitate you, cause you to actually have severely high fevers and extreme colds and chills, to the point where medication doesn't even work, and most of these patients need to be admitted to hospital to receive critical medical attention. So because of the state of starvation can actually negatively affect your immune system, and this leaves you open to several other complications. Not to mention that you are already in a state of starvation and you're carrying a pregnancy. And this condition never ends. It is a torturing experience, and that is why at Antai Hospital we urge our patients to actually receive preventive treatment at Antai Hospital. Right now, our treatment is the most effective management method, and we don't require you to actually be under all kinds of different medications, drugs, injectables. We only use one medication, which is our HG Desensitizer, which we conveniently call our HG vaccine. And once administered, we block the abnormal receptors present in your symptoms, and these symptoms will not arise if you receive it at the correct timing. Now, we understand how difficult it is for patients to have HG and a pregnancy at the same time. So do receive it before pregnancy or in the early stages so that you won't see any symptoms at all, and you will enjoy a smooth pregnancy for once in your in your pregnancy history. It is in fact possible, and it is in fact treatable and entirely preventable at Antai Hospital. So if you are interested in seeking our treatment and also learning about this disease, how it affects women, and what other complications and symptoms it can cause, please check out our playlist, our previous videos on this topic. We go in depth and go on each different symptoms, and all of it can be prevented effectively, uniformly with our HG vaccine. So do stay tuned to our next video, and if you'd like to receive this treatment or talk to our doctors, please visit the website and set up a consultation. Stay tuned to the next one.